We're on track to be the first, as soon as the current supply allows, to provide for 1 million doses. Toronto alone has vaccinated more people than have been vaccinated in York Region, Peel Region, and Ottawa combined. More than 150,000 people have already registered to get their vaccine at a city-run clinic. On top of that, many more have signed up with hospital and healthcare partners. Almost 75,000 people have registered to get vaccinated since the province agreed to our request to lower the age of eligibility to 60. Throughout the Easter long weekend, our clinics were over 90% booked each and every day. I continue to urge all residents who are eligible to get vaccinated, please. The stories we've heard from doctors in recent days of people suffering and dying from COVID-19 are heartbreaking, as has been the case with the more than 2,800 people that we have lost in the city of Toronto alone since this pandemic began. The virus is real, and the variants are raging right now. The vaccines, any of them, will help protect you and your loved ones. So please get informed, please get registered, and please get vaccinated. Go to toronto.ca/COVID-19 or call 1-888-999-6488 to book your appointment today. I want to thank Premier Ford and the provincial government for moving ahead today with further public health measures to help put down the third wave that is currently raging. These decisions are difficult and require courage. As you know, I said last week that as mayor, I would support a stay-at-home order and tighter capacity restrictions if public health officials recommended them. I welcome the fact that the measures announced today do try to address some of the unfairness that has existed as between small business owners and big box stores being able to sell non-essential items over the past number of months. Also, I support the suspension of residential evictions that the Premier announced today, as I have done over prior months. This is also the right thing to do. And it is clear that the province shares our focus on getting vaccines to hotspots where they're needed. This shutdown is province-wide, and we know consistency is needed in order to ensure that we can stop the virus everywhere. Now all we have to do is to do our part and to stay home as much as possible and continue to wear our masks and not socialize with people we don't live with and the rules that people are very familiar with. During this shutdown, we are racing to get people vaccinated as much as we can with the supply that's provided and available to us. I have asked our public health officials and city staff to work with our hospital and healthcare partners to develop a Phase 2 plan, which will ensure that our Team Toronto approach to vaccinations continues and increases in effectiveness. The objectives are simple. 1, continue our coordinated Team Toronto effort involving everyone who is providing vaccines to people in the City of Toronto. 2, use every dose as fast as possible. 3, make sure we are doing all that we can to vaccinate our vulnerable residents, especially essential workers, where many of them live, namely in hotspot neighborhoods. We understandably talk a lot here about our city-run clinics, but every day there are and there have been dozens of other vaccine clinics in operation across Toronto run by our hospital and healthcare partners. Our public health officials have been clear that we must all focus our efforts on hotspot neighborhoods in our city, and the easiest way for people to understand that and to access a vaccination is by postal code. So we are working with the hospitals and other healthcare teams and with our own city teams to operate more mobile and pop-up vaccine sites in hotspot neighborhoods as soon as possible. We have to get shots in arms in areas where they're needed the most. We're announcing today that Toronto Public Health has worked with our hospital partners to ramp up our vaccination efforts in these hotspot areas. There's an absolute need to vaccinate essential workers, and this plan will ensure that we bring vaccines to the 111 neighborhoods that we know are COVID-19 hotspots and where essential workers and their families live. Ontario health teams and hospital mobile clinics and pop-ups will be vaccinating people 18 and older in these neighborhoods identified by their postal codes. The combination of age and postal code will determine eligibility for a vaccine. Some hospitals already have this work underway, and I encourage people who are eligible based on age and postal code to get vaccinated right now. It's never too soon. We've been working with the province to lower the age of eligibility further down in these hotspot areas, and so today's announcement is welcome. Public Health is also working with hospitals to establish essential workplace on-site clinics. We would start with piloting at 2 locations that would be focused on vaccinating not only the on-site workers in those workplaces, but also people who live or work in the area surrounding the workplace. Our work and outreach into communities is based on the backbone represented by the city's vaccine sites. We have an excellent system in place right now where anyone who is eligible can register and get an appointment at the city-run vaccination sites. We have 3 more clinics opening next week, which we expect will be popular local options for local residents, just as the recently opened sites have been. Starting Friday, residents 50 and older in high-risk areas, as identified again by postal code, will be able to book vaccine appointments at the city-run clinics. And of course, all of those 60 and above who've been able to register at those clinics for some time will be able to continue to do so. If people can go to these clinics, they should, if they possibly can, and they will get excellent care from our staff as they get their COVID-19 vaccination. But, as we always knew we would have to, we are expanding the system so that we can take vaccines directly to people who need them and, as often as not, may not come to us. These mobile and pop-up teams and hospital clinics also provide first-class care. And they are committed to getting the vaccine where it is needed the most, in the arms of our most vulnerable residents in those hotspot neighborhoods. Our public health officials have been very clear that we must get the vaccine to the neighborhoods that need it the most, and that this data-driven approach will ensure that we get essential workers and their families vaccinated. We're going to take vaccines to the neighborhoods where essential workers live and where they work, and it is my hope that we'll see the success of this strategy and its expansion in the coming weeks, thanks to vaccine supply, which is a necessary prerequisite of this, and thanks to the ongoing support of our healthcare and hospital partners and the province. And I want to at this juncture, because when you ask for these plans and they get put together as quickly as has been the case, it takes a lot of work by a lot of people under the leadership of both Dr. Davila and Chief Pegg, and I want to thank them and their teams for putting together this expansion of our plans into these hotspot neighborhoods so that we can take the vaccines where they're needed the most. I know that the latest shutdown, if you want to call it that, is not what anyone wanted to go through again. We're working harder every single day, as I've tried to evidence today, to get these vaccines into the arms of those who need them the most. This effort will continue throughout the shutdown, and I'm confident it will allow us to emerge and avoid further shutdowns and lockdowns over the course of the summer. That's what this is all about. We stay home now, we go and get vaccinated now, we save lives, we save our summer, and much, much more than our summer. We save socially, we save economically. We have benefits right across the board. If we can do that now, stay home and get vaccinated. We get more people, essentially, and especially our essential workers, vaccinated now. We save lives. We save jobs. We save the summer. We save economic damage, further economic damage. I'm confident that the steps announced today in the vaccination area, together with the provincial actions undertaken today, will move us in the right direction of those goals, starting right away. And I thank you in advance for your anticipated cooperation, both in following the public health measures and in arranging to get yourself and to get your family and your friends vaccinated as soon as you are eligible. I'd now like to